Hi, I'm Gary White for Channel 6 Central Kentucky Television, and I'm here with Marion County Jailer Barry Brady, and we're talking about the coronavirus and its situation here. The Marion County Jail is a unique situation because, as you're saying, it's a city to itself, really, right here, that's kind of contained. What are you doing with regards to the corona situation?
Well, Gary, of course, our first conversations was with the governor and the Kentucky Health on Wednesday, and we shut down all of our community service details, which, you know, it's concerning to people because we got used to that labor force being in our communities and helping our government agencies. But the risk that we run here at the detention center, jails, prisons, hospitals, nursing homes, and schools is that what the medical folks know about this virus is that the best practices is practicing the 6-foot space, like we're doing right here, the 6-foot space. Respecting that, using great hygiene and sanitizing areas on a constant basis. Well, having a contained environment where I do not have the luxury of placing inmates in their individual cells or rooms, because where the majority of my population is in dormitories, some as big as 20, and some areas are access to each other as big as 80. So the outbreak or the threat that would happen in a jail or a prison is magnified greatly. And, you know, on some of our concerns is that public could say, well, you're putting a lot of concern on that particular population. You know, what about nursing homes? We're all of us are in that same arena. And one thing is that once it starts, it could spread rapidly, and then it would affect to my staff, which makes it a public safety concern. And we don't want to be the one that has to be pulling resources from the society and other parts of our state that need it. So responsibly, this is the area that we're having to do. So everyone that's even with that, we still have staff that are coming and going. So the process of containment there is that as starting last week into this week, every staff member that goes into work has to go through a check of their physical temperature, body temperature, and we are asking our employees, please, if you are sick, if you feel sick, if you've had the sneezing, coughing, fever, stay away. Stay home. Stay home and take care of yourself. And that's the thing, Gary, it says what we've learned about this, or what we're learning about the COVID-19, is that a 14-day self-quarantine, an individual that has traveled, or come in contact with individuals that have shown positive, it is the best practice. So that's what we're going to ask of our employees, to be forthright with us. I don't think anybody's doing any vacations right now. It's probably not the most wise time for us to be traveling beyond our communities very far. Unless there's absolutely a necessity. It is scary times for us all.
Absolutely. So I was talking just recently with Marion County Judge Executive David Daugherty, and they were saying that usually you had inmates that would help with the trash pickup and help in the communities in various different ways, but all that has been shut down.
Yes.
As a containment.
And that's too. There was some questions that immediately when some of those decisions were made, and it was on the public health out of Kentucky. That asked us, said, because these individuals, we're going to ask our county employees or our city employees to do the same jobs. Why would we stop the prison population? again, it's because we live in a confined area that has we don't have the ability to self-quarantine. Every individual's here. And as of this morning, I was at 300 in this inside the building here. It is very dangerous for all of us working here, the residents that have to stay here, and for us to provide public safety if we had an outbreak. So we're taking what we see as the necessary precautions, trying to be considerate. And the other thing, you know, Gary, we had to shut down. We had a large faith-based volunteer groups that were coming in on a regular basis. It's very positive. It's part of the rehabilitation. It's part of reducing recidivism, having our faith base in here, doing church services. But all of that had to cease as well. Our outside resources for GED, we have kind of stalled and stopped all of those. So it adds another element for me and the employees, and that is focusing on our own personal mental health as well as the inmates' mental health. And so we are, you know, we have contained rec areas outside of the cell, which are covered. They got fresh air covered, but they can be covered if it's raining. And so we're trying our best to do as much as that as we possibly can. We'll take out one cell at a time, let them do some out of the cell activity, and then take them out of the area, sanitize the area when we move them back. So we're doing a lot of dumping the cells, cleaning cells, and then they'll get back and get comfortable and they'll say, well we're going to do it again.
Yeah, so it's a lot of additional
efforts to be safe.
Absolutely. Now, so are you still having classes for the inmates in the facility themselves?
The only ones that are in kind of like active would be in the treatment programs and stuff, which those section of inmates are quarantined to their area. So there's an area of 40, and then there's an area of a couple areas of 80. But so they're just operating within their area, having their interaction, not associated with the other part or intermingling with any kind of church services.
Right.
So we're trying that as long as we can to do that. So we're just trying our best to be safe and smart.
Now, we say that this is a contained area, but also the population changes somewhat every day.
Oh, yes.
So what are you doing to maintain the...
Well, we have been very fortunate. I'd have to put a lot kudos out to Judge Todd Spalding and all of the judges, but Judge Spalding was kind of the first to the forefront and saying that, guess what, we'll do what we need to do in as far as containment, leaving people incarcerated that are a danger to others and stuff. And our law enforcement has actually stepped up too, and trying not to make any arrest on failure to pay a fine or something of that nature. So some of those things that would typically be arrestable offense, they're using discretion and just making cite or a citation or something on them. So in the event, and that's the part of the thing, we are a part of our justice, so we cannot shut our doors. We cannot say no to an arrest. So in the process of the individuals that are arrested, and there will be people arrested through this process, we are screening the individuals immediately upon entering the facility. So we do, we had already had a risk and needs assessment of 100 questions. Now it's probably 110, 15 questions, and we do immediately doing temperatures and stuff of the individuals, taking their temperature and stuff when they arrive, and sometimes even if We've even asked if law enforcement is asked to enter into the building, Probation Pro asked to enter into the building to speak with someone, they too have to have their temperature taken to make sure they do not have no fever and stuff. So once the individual is brought in and we've identified that, we still are trying our best, and that's what makes it so difficult in such tight quarters with so many individuals,
right,
is that we're trying to keep that social distancing, but trying to make sure that we keep individuals separated. So we're trying to open up some spots up front that we can honor a period of time that they could be evaluated, so that we can ensure that maybe possibly, hopefully, that they're not affected before they go to be processed into the jail. So with limited space, that can be very difficult.
Right.
I think this past weekend we was very fortunate. It was about 2 arrests for the weekend.
Wow.
And so I feel, I maybe even some of the activity has ceased. I don't know. Hopefully everybody in our communities is taking it serious and staying home, because
right,
the unknown about the COVID-19 as we deal with it and as we have outbreaks is going to be challenging.
Absolutely. And we say this is the Marion County Jail, but it actually serves Washington County as well, but it also
Yes.
has inmates, state inmates, and inmates from all around that
Yes,
come
it
here.
does.
So
Oh,
it's
no,
not
yeah,
just here in Marion County.
Yes, no, we've housed for federal, state, Washington County, and Marion County. Our federal count is down. I'm looking that during, as we've faced this crisis, because of the risk that there is for the people working the jail as well as the residents inside the jail, as we try not to pull from resources from the community if we did have such a case of an outbreak. So there's daily meetings in Frankfurt. We do get phone calls. I've had to phone call the governor, public health, and Secretary of Justice, conference called every single conference called every jailer across the state of Kentucky to initiate some of these efforts as of last Wednesday. And I feel very good about our governor's approach. And the more we learn about contagious diseases, this is the correct way to approach it, and that is swift and use the precautions that we need in place.
So with testing has been an issue around the whole country here in the United States so far, because there just aren't enough of them. Has there been any testing done here at the Marion County?
No testing, and extremely fortunate to not have anyone that displays symptoms and stuff. One of my first stops once I come into work in the mornings is after I get my temperature taken and drop my coat off at the office, I go straight to medical, and the first thing we're starting to debrief is to find out if we've got anyone that has complaints, any fevers. And that was it's always a good morning. You go in and medical says, guess what? No one's complaining and no fevers this morning. So we could actually, if keeping our separation, and if it depends, if we don't know really, if it's a 14-day incubation period, we really don't know if we have been exposed. Right. So that's the unknown that is looming on whether we're at our local stores, or wherever we're at in the public. I mean, pumping gas or doing whatever. We need to really be cautious, because we don't know exactly who's been affected. Right. The tests are going to be wonderful. I hope and look forward to the day that all of us, as our constituents and our neighbors and everybody, get an opportunity to ease their mind if they've been affected by it or not. So that we can start to correct it.
Right, we'll have an accurate number at that point. And again, everything we're saying today is as of Tuesday, March the 17th. So it may, it's a constant
Yeah, it's a
situation.
constant, it's evolving. And Gary, I know that our county judge has been on calls with, been on a call with the governor. Myself have been on those calls. Our local officials, everybody is concerned. We try to educate people. We don't want people to be fearful. At the same time, to take it seriously. The other thing is we must focus on our mental health as we go through this trying time. So when you get an opportunity to walk in your backyard or out in the field or just do something different, make sure you keep your...
I also want to mention with visitors. Are you allowing visitors?
No, all of our stuff is electronic.
Right.
So that's a very, in technology age, is very beneficial because we was already set up so the individuals that have iPhones, Samsungs, computers with the camera from home, they can video visit their loved ones and never leave their home and come in. Now we do have, we're not even allowing contact or even attorney. All of the attorney visits, everything are through glass, so that they do not have direct contact. For the moment, our lobby has remained open for the purposes of families depositing money on kiosks and using the video visiting stations that are out front. If you know, it depends. It's by day what we do, and everything is going to be outlined with what happens about the impact of this virus.
Absolutely. Again, I've been talking with Marion County Jailer Barry Brady. We're at the Marion County Detention Center, and this is the status of what's going on here right now.
Okay.
Thank you very much.
Thank you very much.
It's been Gary White for Channel 6 Central Kentucky Television.